And then other studies of interest, I think, as we explore not just sort of additional indications here where we would move up CAR T cells a line of therapy, is other indications. So for example, there are studies in mantle cell lymphoma. There are also studies looking at combining CAR T cells with checkpoint inhibitors. There are a couple of studies in that space. So I think we need to see the results of those studies as well. I think the results in follicular lymphoma are very promising. There were results presented already by the group from Penn. Very small series, about 14 patients, but the survival curves were fantastic. And then a paper actually published by the group in Seattle. Also a small series of patients with follicular lymphoma. And what was interesting, they compared follicular lymphoma to patients with transformed follicular lymphoma. And you could clearly see that the patients with follicular lymphoma did much better than those with transformed. And their results were in line with the results from Penn. So I think the results of CAR T cells in follicular lymphoma are very promising. Obviously, we have a lot of other options in those patients, and those patients also, tend to get treated later. So I think we'll have to see what exactly the role is of CAR T cells in follicular lymphoma, but it's definitely a therapy that's very effective.